Hello learners, my name is Dr. Swati Bist. I am former assistant professor in Indira University, Haryana, Rewari. So today in the present video, I am going to discuss about male reproductive system part 2nd. In the earlier video, we had discussion about male reproductive system. We discussed about the various parts of the male reproductive system. Now in the present video, we will proceed further. So in the present video, it will help student to know in detail about urethra and external genital, that is penis and its structure. Secondly, the present video will help student to acquire knowledge on the composition of semen and basic structure of sperm, and it will also help student to understand puberty in males. It will help student to develop understanding on the hormonal control of the male reproductive system, and at the last of this video, we will discuss about various disorder related to male reproductive system. So, student they will get familiar with various disorder related to male reproductive system. Now, the male urethra, it originates from the internal urethral orifice to the tip of the penis, and the length of male urethra is generally 16 to 20 centimeter. And the male urethra, it provides the common pathway for the flow of urine and semen. But one needs to note down that at one time either the urine or the semen will pass. The two cannot pass together from the urethra. So, this is the male urethra. Now, the male urethra, it has two urethral sphincter. First is internal sphincter, that is under involuntary control. That means, we do not have control over the internal sphincter. It consists of smooth fibers situated at the neck of the bladder above the prostate gland. Then comes the external sphincter. This is under voluntary control. That means, a person can have control over the external sphincter. It consists of skeletal muscles, fibers surrounding the membranous part. Now, it consists of three parts. First is prostatic urethra. It originates at the urethral orifice of the bladder and passes through the prostate gland. Then comes membranous urethra. This is the shortest and narrowest part and extends from the prostate gland to the bulb of the penis after passing through the perineal membrane. Then comes the third part, penile urethra. It lies within the corpus spongiosum of the penis and terminates at the external urethral orifice in the gland penis. So, it has three parts. First is prostatic urethra, second is membranous urethra, and third is penile urethra. Now, we will discuss about the penis. So, the penis, besides providing passage to the urine from the body, it transfers semen into the reproductive tract of the female during copulation. Now, this is the structure of the penis. One can see this is the base, this is the middle part, this is the body, or we can say the shaft, and this is the head. This is the head or the glans. So, these are the three basic part of the penis. This is the base, this is the body or the shaft, and this is the head, this is the glans. So, it has a root, body and head. The root lies in the perineum and the body surrounds the urethra. At the tip of the glans penis is the slit like opening called external urethral orifice. So, through this external opening, the semen and the urine is passed outside the body. This gland penis, it has the pigmented folded skin, which is also called pappus or the foreskin. So, it contains three masses of erectile tissue. The two lateral column are called corpora cavernosa, and the column in between them containing the penile urethra is the corpus spongiosum. At its tip, it is expanded into a triangular structure known as gland penis. So, this gland penis, it has a loose folded skin, it is pigmented, and it is also called pappus or the foreskin. So, we can have a look. This is the corpora. This is the outer layer is corpora cavernosa, the inner layer, the middle layer is corpus spongiosum, and inside it there lies here is this is the urethra, and this is the head, it is the pigmented skin and which we can call foreskin or the purpose. Now comes ejaculation. During ejaculation, which occurs at male orgasm, sperms are expelled from the epididymis and pass through the deferent duct, the ejaculatory duct and urethra. The force generated leads to the emission of the semen through external urethral sphincter. Now, we will discuss about semen. So, the volume of semen, it lies between 2 to 5 ml of semen is produced in a normal ejaculate, which contains 40 to 100 million sperms per ml in a normal male, and this semen is slightly alkaline. Again, as we know, this alkaline semen helps to neutralize the acidity of vagina and the walls of urethra of the male. Then the sperm comprises only 10% of the final ejaculate. The rest contains secretion of seminal vesicle, prostate and bulbourethral glands, which are added to the sperm during male orgasm, as well as mucus in the urethra. So, if the ejaculate, the sperm with the course of time they loses their fertility, and if they are not ejaculated outside, then they are basically they are absorbed by the epididymis. Now comes the process of spermatogenesis, that is the formation of sperm is known as spermatogenesis, and it takes place at temperature about 3 degree below the normal body temperature. So, spermatozoa, that is sperms are produced in the germinal epithelial cell of the seminiferous tubule. So, there is the spermatogonia, which is 2N, basically diploid. That means it has 2 pair of chromosomes and it goes through mitotic and meiotic division, and it reduces the number to give rise to male gamete, that is sperm, which is haploid. That means it has only one set of chromosome, it is N. Tubule, so they are produced through the process of mitotic and meiotic division. So, it get reduced. So, from diploid cell, the spermatogonia which are diploid, they are reduced to sperm male gamete, that is the haploid cell, and they mature as they pass through the long and convoluted epididymis. There they are stored. So, this is the process of formation of sperm from spermatogonia to male germ cell, that is the sperm which is haploid. We will have a look at this picture. This is the picture of a sperm. Here you can see this is this portion, this is the head, and inside it there is a nucleus. Then this middle piece which is containing mitochondria, and then comes this one, this long tail like structure, this is the tail of the human sperm. Now, we will discuss in detail. So, sperms are microscopic and motile cells. A mature sperm has a head, a body and a long tail. Head contains nucleus, DNA and enzymes, acrosomes. It contains hyaluronidase proteolytic enzyme required to penetrate the outer layer of ovum to reach and fuse with the nucleus. So, it plays an important role in the fertilization process. Then body is packed with mitochondria to fuel the propelling action of the tail that powers the sperm along the female genital tract. So, it ensures the motility of the sperm so that they can reach inside the female genital tract. Now, in the present slide, we will discuss various physical changes that take place during the phase of puberty in male. So, the onset of puberty in male is approximately at the age of 13 to 16 years, and this occurs because of the influence of male androgen, that is testosterone. So, testosterone, it is responsible for the secondary sexual characteristics. Then during puberty, there is growth of muscles and bone and marked increase in height and weight. Then further, there is enlargement of larynx and deepening of voice. Then growth of hairs on chest, abdomen, face and pubis. And further, there is enlargement of penis, that is in terms of length and thickness, scrotum and prostate gland. Then there is maturation of seminiferous tubule and production of spermatozoa, that is sperm inside the seminiferous tubule. Then the skin of the boys, teenager boys, start thickening and it becomes more oilier. Then like in female, generally at approximately above 45 they touches menopause. As such, there is no such process in the male, but at the age of 50 years, the level of testosterone, it goes down, it gradually declines. So, certainly it affects the male libido, that is urge for sex, and to a certain extent it also affects the sperm count and the sperm quality of the male at around 50 years and above. Now, after having a detailed discussion on various parts of the male reproductive system and sperms, semen, now we will discuss and have a look on the how various hormones act on the male reproductive system. So, hormonal control of male reproductive system. So, this one is the hypothalamus gland. It secretes gonadotropin releasing hormone which further acts on the anterior pituitary gland, and this anterior pituitary gland, it secretes two hormones. First is LH, that is luteinizing hormone, and other is FSH, that is follicle stimulating hormone. This LH, it acts on the Leydig cell. As we all know, Leydig cell, it lies outside the seminiferous tubule, between the seminiferous tubule in the connective tissues. So, LH, this luteinizing hormone, acts on the Leydig cell, and this Leydig cell then further secretes testosterone, that is the male androgen. And this testosterone then stimulates the process of spermatogenesis and responsible for the onset of puberty. Now, this LH acting on Leydig cell giving rise to testosterone, and then it further stimulates spermatogenesis and onset of puberty. So, this is whole positive feedback system where there is further secretion of testosterone and processes going on, right. Then this FSH, follicle stimulating hormone, it acts on the Sertoli cell. The Sertoli cell, it provides nourishment to the sperms and it further secretes ABP, that is androgen binding protein, and inhibin. Now, this androgen binding protein is very crucial. It gets binded with the testosterone. As we all know that testosterone is secreted outside the seminiferous tubule. So, testosterone binds with the ABP, that is androgen binding protein, and this helps to get it inside. The testosterone get it inside. It helps to concentrate testosterone inside the seminiferous tubule, which in turn stimulate the process of spermatogonia to stimulate sperm production. So, it further stimulates the process of spermatogenesis, that is the production of sperm. So, all this is the positive feedback system where LH is acting on Leydig cell is acting on testosterone, and again FSH is working on Sertoli cell is giving secretes ABP and inhibin. These are the positive response. But once a certain optimum level of testosterone and sperm production has been achieved, there is a regulatory system as well. This inhibin, this regulates. It starts once the optimal level of testosterone and sperm has been achieved. So, it gives a negative feedback system to the anterior pituitary gland directly and indirectly to the hypothalamus gland. So, inhibin directly works on the anterior pituitary gland, it gives the negative feedback system and hypothalamus gland, and this negative response it regulates the further production of FSH, or it stopped the production of FSH and LH, and thereby it stopped the further production of testosterone and the process of spermatogenesis. So, this is how the hormonal control of the male reproductive system works. So, there is a positive feedback system and negative feedback system to check the excess production of testosterone and the sperm. Now, till now we have discussed in detail about the male reproductive system, how various hormones acts on each other and how they secretes and how the process of spermatogenesis, testosterone and the production of sperm is regulated by the hormonal system. Now, we will discuss in detail the various male reproductive disorders. Now, the male reproductive disorders, they could be, first is erectile dysfunction and pre-ejaculation. So, as we know what is erectile dysfunction, it is inability of a male or inability to sustain enough erection that is hard enough for penetration. But if this happens repeatedly, then it could be a sign of a erectile dysfunction. It may occur once in a while, that is not erectile dysfunction, but if it happens repeatedly where a male is unable to achieve erection that is hard enough for penetration, then it is a erectile dysfunction. And then comes pre-ejaculation, that is the ejaculation of the semen much earlier. Then comes the second problem, that is the problem of infertility. So, nowadays one can see there are various factors, environmental factors, stress and various other factors, because of which various male they are facing the problem of infertility. So, it could be of various reasons. The first could be there is low sperm count. So, low sperm count is, according to the WHO, male should have a sperm count of around above 15 million per ml. So, it should have above 15 million per ml is considered to be the normal, and if a sperm count is below 15 million per ml, then it is the low sperm count. It could be the case of low sperm count. And the second is azoospermia, that is azoospermia is basically where there is nil sperms, or the number of sperms they are beyond measurable range, that is azoospermia. Then there are many other reasons for infertility, it could be the STIs and many more. Then comes the third disorder, that is testicular cancer. So, it is basically the cancer of testis. Then prostate cancers, generally this occurs during the advanced stages or the advanced life of a human being. So, it is the cancer of prostate gland, and in this a person might feel frequent urination, or there is a distress during urination that might be experienced by a person. Then comes varicocele. So, what is varicocele? In a varicocele, there is enlargement of veins in the scrotum, and this condition it may interfere with the production of sperm, and this may interfere with the male fertility. Then comes hyprocele, hydrocele, there is accumulation of fluid inside the scrotum. Then there is one more important condition disorder, that is cryptocardism. Cryptocardism. So, in this condition the testis they do not descend outside abdominal cavity into the scrotum. So, this generally occurs during this deficiency or this discrepancies happens during early fetal development. Now, the last one is STIs. As we know, STIs, that is sexually transmitted infections. So, it could be the STIs could be chlamydia, a bacterial infection that can affect the urethra, rectum and throat. Then gonorrhea, a bacterial infection that can also affect the urethra, rectum or the throat. Then syphilis is a bacterial infection that progress through the stages and starting with a painless sore. Then come genital herpes. So, a viral infection causing sore and blisters in the penis. Then HIV, as we all know, this is the viral infection that weakens the directly affects the immunity of a person. Then comes trichomoniasis. So, a parasite infection that can cause symptoms like burning during urination. So, gonorrhea, syphilis, this may seriously affect a male fertility. So, this is all that may occur in a male. These are the male reproductive disorder. With this, I would like to wind up my lecture. Thanks a lot for your patience. Thanks.